Your blood pressure reading may be giving an incomplete picture. Every time that measurement is taken in a medical office, it captures only a single moment. When you sit quietly, both feet on the floor, your arm positioned at heart level, and your body relaxed, that result reflects one thing only. It shows what your blood pressure is doing under ideal conditions that rarely resemble real life. It does not reveal what happens when you bend down to lift a grandchild. It does not show the changes that occur at 3 a.m. when you wake up and walk to the bathroom while still half asleep. And it certainly does not capture what occurs during what researchers now describe as the morning danger window. This period lasts about 90 minutes after waking. During that time, the cardiovascular system experiences greater strain than at any other stage of the day. After reviewing a large number of scientific studies, one conclusion becomes clear. The discussion is not only about what blood pressure target should be reached. The more important issue is when that number matters. The exact same reading can represent safety in one situation and serious danger in another, depending on the time it occurs. Researchers have also identified something known as reverse risk. Their findings showed that the healthiest older adults were not necessarily the ones with the lowest blood pressure. They shared a different characteristic that turned out to be far more significant. Consider a thermostat inside a house. Set it to 68 degrees in a well-insulated home with solid windows, and everything functions efficiently. But place that same setting in an aging farmhouse with drafts, thin walls, and gaps beneath the doors, and the heating system works constantly while still struggling to maintain comfort. The target remains identical. The outcome is completely different. The cardiovascular system follows a similar pattern. At 45, blood vessels are generally flexible, responsive, and efficient. A blood pressure of 120/80 supports normal function throughout the body. By 78, however, those vessels are no longer the same. They become stiffer. The inner lining grows thicker. Tiny pressure-detecting structures within artery walls, known as baroreceptors, respond more slowly, much like smoke detectors running on old batteries. At the same time, the liver and kidneys process medications at only about 60 to 70% of the capacity they once had. As a result, applying the same target of 120/80 to an older body can create problems. It is comparable to demanding that the drafty farmhouse maintain 68 degrees without interruption. The heating system, represented by the heart, must work harder. The plumbing system, represented by the blood vessels, struggles to provide adequate circulation, and the areas farthest from the source, including the brain and kidneys, may receive less support than they need. This concept is supported by research. A major analysis published in JAMA Internal Medicine followed more than 15,000 adults over the age of 75 for 5 years. Researchers grouped participants according to their average systolic blood pressure and monitored the outcomes. The findings challenged long-standing assumptions. Individuals whose systolic pressure remained below 120 experienced a 28% increase in serious falls requiring hospitalization. Their incidence of acute kidney injury also increased. Most strikingly, their overall mortality rate was 14% higher than that observed in participants whose readings stayed between 130 and 140. Those with numbers considered less than ideal actually lived longer than those who maintained textbook perfect values. Meanwhile, participants above 150 experienced the expected consequences. Stroke rates increased. Cardiovascular events became more common. That result was not surprising. What surprised researchers was what happened at the lower end. For the first time, evidence on a large scale suggested that driving blood pressure too low in older adults could be just as hazardous as allowing it to remain excessively high. The relationship between blood pressure and risk is not a straight descending line. Instead, it forms a U-shaped curve. The safest position lies near the bottom of that curve, and that point appears higher than many traditional recommendations suggest. Another issue receives far less attention than it deserves. Many cardiologists have recognized it for years, yet it remains largely overlooked in discussions about senior health. This phenomenon is called the morning blood pressure surge. Between approximately 4 a.m. and 9 a.m., the body undergoes a significant hormonal transition. Cortisol levels rise, adrenaline increases, the nervous system shifts from nighttime recovery mode into daytime activity mode. In younger individuals, this adjustment usually occurs smoothly. Blood pressure increases gradually, blood vessels adapt, and the transition passes almost unnoticed. For older adults, especially those taking blood pressure medications that begin losing effectiveness during the night, the change can be much more dramatic. A person may register 108/62 at 3 a.m. That level can be dangerously low while the brain is attempting to consolidate memories during sleep. By 7 a.m., the same individual may reach 165/92 as stress hormones flood the bloodstream. This movement from very low overnight readings to elevated morning levels is known as blood pressure variability. Growing evidence suggests that, among seniors, this fluctuation may predict heart attacks and strokes more effectively than an average blood pressure reading alone. Imagine a river flowing at a steady, moderate speed. The banks experience little damage. Now imagine that same river alternating between a trickle and a flood. The shoreline begins to erode rapidly. Blood vessels face a similar challenge. Research published in the journal Hypertension tracked more than 6,000 older adults. Investigators discovered that participants with the largest morning surge, defined as an increase of 40 or more systolic points between nighttime and morning measurements, faced nearly twice the risk of stroke compared with those whose rise was more gradual. This remained true regardless of their average blood pressure values. Read that carefully. Individuals whose average readings appeared normal but experienced dramatic morning fluctuations carried a greater risk than those whose numbers stayed slightly elevated, yet remained stable throughout the day. That is why one blood pressure measurement taken at 2 p.m. on a Tuesday reveals very little about what is truly occurring inside the cardiovascular system. It is similar to checking weather conditions at noon and assuming they were identical at midnight. Blood pressure follows its own rhythm over 24 hours. Understanding that pattern provides far more insight than focusing on a single fixed number. When excessive blood pressure treatment in older adults is discussed, falls and fractures usually dominate the conversation. For good reason. A broken hip at 80 years old can change a person's life dramatically. Yet there is another consequence that receives far less attention, and it involves the brain. Although the brain accounts for only about 2% of total body weight, it requires roughly 20% of the body's blood supply. No other organ demands so much circulation. Unlike muscles, which can tolerate temporary reductions in blood flow, the brain reacts within seconds when supply begins to decline. When blood pressure is lowered excessively in an older adult, the brain may receive insufficient perfusion. Not necessarily enough to trigger a stroke, but enough to create a long-term shortage. Think of it as a brownout rather than a complete blackout. The lights remain on, yet they flicker. Brightness fades, performance suffers. A landmark investigation published in JAMA Internal Medicine evaluated more than 8,500 adults whose average age was 76. Researchers found that participants whose systolic pressure was aggressively reduced below 120 experienced noticeably faster cognitive decline over a 3-year period than those maintained between 130 and 145. Month by month, the differences appeared modest. Over several years, however, the separation became substantial. Memory performance declined more quickly. Processing speed deteriorated. Executive function also worsened, including the ability to plan, organize, and make decisions. Every one of these measures declined at a faster rate among those receiving the most intensive treatment. The irony is that many people interpret the earliest warning signs as nothing more than normal aging. Thoughts seem less clear. You enter a room and forget your purpose. A familiar name refuses to come to mind. The response is often simple. I'm 78. What else would I expect? Yet in certain cases, that mental haze may not be aging at all. It may be underperfusion. The brain may not be receiving enough blood flow because medication has lowered blood pressure to a number that appears ideal on paper while leaving nerve cells operating with limited resources. One point must be stated clearly. This is not a recommendation to stop taking prescribed medication. What it does mean is that persistent brain fog, concentration difficulties, or new problems finding words deserve a serious discussion with a physician regarding whether the current blood pressure goal remains appropriate. These symptoms are not merely inconveniences. They are pieces of information, and they matter. Now consider the ranges supported by evidence from multiple large studies. These are not absolute rules. An individual's ideal target depends on overall health status, activity level, medication tolerance, and many additional factors. They should be used as starting points for conversations with a doctor, rather than personal prescriptions. For adults between 65 and 74 who remain generally healthy and active, a systolic range of 130 to 140 appears to provide the most favorable balance between cardiovascular protection and adequate organ perfusion. This range sits slightly above what many guidelines continue to recommend, yet data focused specifically on older adults supports it. For adults between 75 and 84 who are in reasonably good health, evidence points toward a systolic range of 135 to 145. This range reflects greater arterial stiffness, slower baroreceptor responsiveness, and reduced medication clearance. If a 79-year-old is being pushed toward a target of 120, that topic may warrant further discussion with a physician. For adults older than 85, or for anyone considered frail regardless of age, a systolic range of 140 to 150 may offer the strongest combination of cardiovascular protection and fall prevention. At this stage of life, maintaining independence and mobility often becomes more important than pursuing a specific numerical goal. The lower number, known as diastolic pressure, receives little attention in popular health discussions. For older adults, however, it remains extremely important. Diastolic pressure represents the period when the heart relaxes between beats. That interval is when the heart muscle itself receives blood flow. If diastolic pressure consistently falls below 60, the heart may not receive adequate circulation during its own recovery phase. For seniors, the preferred range appears to be between 70 and 85. When readings repeatedly fall into the 50s or the lower 60s, that information deserves attention even when the systolic value appears acceptable. There is another factor that standard blood pressure charts fail to show. More important than any individual reading is how stable that reading remains throughout the day. Someone whose pressure consistently stays around 138/78 is generally in a safer position than someone whose measurements swing between 110 and 170 depending on the hour. Stability is the hidden measurement, and uncovering it requires more than occasional office visits. There is a simple approach that can begin immediately and may provide a clearer picture of cardiovascular health than many routine examinations. It is called the 2-week blueprint. All that is needed is a basic home blood pressure monitor, available at most pharmacies for around $30, along with a notebook. The process is straightforward. Every morning, within 30 minutes of waking and before coffee or medication, sit down and measure blood pressure. Record the result. This captures the morning surge and reveals what the body is doing before medication begins influencing the numbers. Each evening, at approximately the same time, take another reading. This shows how medication and daily activities have affected blood pressure throughout the day. Twice during the 2-week period, for example, on day 3 and day 10, perform an orthostatic test. Begin by lying flat for 5 full minutes. Then measure your blood pressure while remaining in that position. After taking the measurement while lying down, stand up and check it again immediately. If the systolic value falls by more than 20 points, or the diastolic value decreases by more than 10 points, that indicates orthostatic hypotension. In that situation, the body is not adjusting properly to a change in position. That single finding can provide more useful clinical information than numerous readings collected during office visits. Consider a practical example. Imagine that morning measurements average 152/84. Evening measurements average 128/72. That represents a 24-point systolic difference. The issue is not simply whether blood pressure is high or normal. The issue is instability. Now imagine the orthostatic test performed on day 3. The reading while lying down is 126/74. After standing, it falls to 94/58. That equals a 32-point drop in systolic pressure. With information like this, the numbers begin telling a clear story. Medication may be losing effectiveness by morning and becoming too powerful later in the day. Data of this kind changes a routine appointment from a brief blood pressure review into a meaningful discussion about treatment. Physicians value organized home records because they provide information that cannot realistically be gathered during a 15-minute office visit. This does not replace professional expertise. It strengthens it. Consider another example that demonstrates why individualized treatment is more important than applying the same target to everyone. Imagine a married couple. Both are 79 years old. Both record a blood pressure of 150/86 during their most recent appointment. The physician is the same. The numbers are identical. Yet their circumstances are very different. The husband has well-controlled type 2 diabetes, mild kidney disease, and received a stent 4 years earlier. The wife volunteers 3 mornings each week, walks 2 miles on most evenings, and takes no medication. Following standard recommendations, the physician suggests the same goal for both individuals: reduce blood pressure below 130. For the wife, Moderate lifestyle changes may be enough. A little less sodium. More foods rich in potassium. Better stress control. Those adjustments might naturally lower her readings to 140/80. For a healthy and active 79-year-old, that range is associated with very positive outcomes. No medication is required. No additional risk is introduced. The husband's situation is different. His kidneys already function under strain. Using aggressive medication to reach 130 could further reduce blood flow to those organs and potentially worsen the condition being treated. His diabetes also changes how blood vessels respond to shifts in pressure. A more cautious target, perhaps between 138 and 142, achieved gradually with a single carefully monitored medication instead of 3, may better reflect the complexity of his condition. The age is the same. The starting numbers are the same. The path forward is completely different. That is the essence of personalized medicine. Patients should expect that level of individual consideration from their healthcare team. Now bring everything together into several practical actions. Begin the 2-week blueprint as soon as possible. Record morning measurements, evening measurements, and the results of 2 orthostatic tests. Write every reading in a notebook. This simple habit can provide more useful information for both you and your doctor than almost any data collected previously. Pay close attention to the difference between morning and evening values. When the systolic gap exceeds 20 points, medication timing may need adjustment. That is a topic worth discussing during the next appointment. Track symptoms alongside every measurement. If standing causes dizziness, record it beside the reading. If mental fog appears after lunch, note the time. If exhaustion develops around 3 p.m., write that down as well. Symptoms without measurements are easy to overlook. Measurements without symptoms tell only part of the story. Together, they create a complete picture. Arrange a dedicated appointment focused specifically on blood pressure, rather than discussing it briefly during a routine examination. Bring the 2-week record and review whether the current target and medication strategy remain appropriate for your age and physical condition. One more point deserves attention: hydration. The advice sounds simple, yet mild dehydration is extremely common among older adults. It directly influences blood pressure values and day-to-day variability. Many seniors no longer experience thirst as strongly as they once did. As a result, they consume less fluid than their bodies require. When dehydration occurs, the blood becomes more concentrated. Readings can temporarily rise while the actual circulating volume remains low. Maintaining proper hydration, approximately 6 to 8 glasses of water daily, adjusted according to a physician's recommendations for individuals with heart or kidney conditions, helps stabilize blood pressure and improves measurement accuracy. At this point, several important facts become clear. A single reading taken in a doctor's office represents only a snapshot rather than the full picture. The morning hours contain a hidden cardiovascular risk that often goes unmeasured. Blood pressure reduced too aggressively after age 75 may increase more than fall risk. It may also gradually affect cognitive performance. Most importantly, there is now a practical, evidence-based method for monitoring blood pressure patterns that can begin immediately and significantly improve discussions with healthcare professionals. That knowledge creates opportunity. It allows a person to move beyond being a passive recipient of care and become an active participant in protecting long-term health. Blood pressure management should always be tailored to the individual. Medical history, current health status, medication response, and many other factors must all be considered. Medication should never be adjusted or discontinued without consulting a qualified healthcare provider. Current research continues to guide understanding, but it does not replace professional medical care. Always seek advice from a qualified healthcare professional before making changes to any treatment plan. If this information was valuable, share it with family members and friends who may benefit from understanding how blood pressure changes throughout the day. Conversations like these can help more people make informed decisions and work more effectively with their healthcare teams. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.